Hi, I'm Anne-Marie Tiernan. March 6th is the anniversary of when the coronavirus arrived here in Indiana. That was in 2020. And we were following this virus as it spread globally, knowing that its arrival here was inevitable. Then, March 6, 2020, health authorities confirmed that a patient here in Indiana tested positive for COVID-19. Rich Van White begins our special with his report from that day.
Today's announcement was part warning, part reassurance. It came from State Health Commissioner Dr. Christina Box. She said this is an isolated case. There is no threat to public health, but more cases of COVID-19 are expected. The medical response was swift. About midnight, emergency room caregivers wearing protective gear met the man in the ER parking lot. They knew he was coming. He called the state health department. They sent him to Community North Hospital and warned the ER. Community, like other area hospitals, has been rehearsing for the arrival of COVID-19. The patient was kept away from other patients, placed in a special isolation treatment room, examined, and tested for the virus.
I want to reassure you that no patients, no other caregivers were exposed to this individual. Again, I want to reassure you that the hospital is doing everything it should, and the risk to patients right now is minimal.
According to the doctor, the man was released about 2:30 this morning. The positive test results came back about 8. He is now under self-isolation with a mild form of the virus. Health officials believe he was probably infected in Boston. He'd been on a business trip there. He came home Wednesday, got a call from his employer and told him that there had been confirmed cases of COVID-19 there and he may have been exposed. An investigation is now underway to see what other travelers, family members, co-workers, and others he might have infected.
Following that announcement, retirement communities statewide started making changes that impacted how residents, families, and workers could come and go from their facilities. The American Village Retirement Community in Indianapolis is one of the businesses that started implementing new safety precautions. They have more than 300 senior residents, and the company went on high alert. Precautions included one-way entries for visiting family, reduced facility hours, constant hand sanitizing for employees, and anyone coming in was greeted with this sign.
They must not have been in contact with someone under investigation for COVID-19. We're taking it seriously just so we can prepare for an outbreak situation.
2 days after the first human confirmed case of COVID-19 in Indiana, 13 News talked to a Muncie couple who was stranded. They were out on a cruise ship. There was a coronavirus outbreak there among the passengers on board.
Vicki and Bill Fisher's 15-day cruise to Hawaii is treading water off the coast of California. The couple from Muncie is quarantined in their room due to a coronavirus outbreak aboard the Grand Princess.
Bill and I don't have any symptoms and are feeling fine, and everybody that we have met out on our balcony is in the same boat as us. But understand, and the expression has been in an abundance of caution.
After illness on board, the National Guard delivered coronavirus test kits. 19 crew members and 2 passengers among the 3,500 people from 54 countries on board have tested positive for COVID-19. Vicki celebrated her birthday Saturday, confined to her room and balcony with room service meals, free Wi-Fi, and on-demand movies.
Really, it could be worse. It could be rough. This is not rough.
The cruise ship is now set to dock in Oakland Monday, but passengers will not go home. They will be taken to federal facilities for testing and isolation.
They're all collaborating and I think trying to keep the whole population safe as they can. I mean, they don't want us, getting off and contaminating anyone, and I'm fine with that.
Getting off the ship just begins another unknown adventure. I'm Rich Knight, Channel 13 Eyewitness News.
On March 9th, Avon school leaders on the west side of Indianapolis closed schools in the districts for 2 weeks. This was their response after one of their students tested positive for COVID-19, and they had another student showing signs of the illness. The closure meant a whole new schedule for the families in the district.
With this and all other Avon schools now closed for 2 weeks, parents are scrambling to adjust work and daycare schedules to keep their children safe at home. Noah worked on math, science, and language arts from the comfort of a family room sofa.
And if I have a problem, I can email my teacher, or there's some discussion boards where I can talk to other people.
Younger sister Bella She learned in her PJs at a kitchen counter. Dad helped.
Those are your 4.
The arrival of the COVID-19 virus and closing schools shocked David Carcarnes.
Really hits home how personal it is and how small this world is and how it affects all of us.
School administrators, acting on the advice of local health officials, closed Hickory Elementary for 2 weeks after a student tested positive for COVID-19. With a second student now showing symptoms of the virus, administrators won't say from which school. All Avon schools are now closed until March 20th. Some parents are scrambling to alter work schedules and find someone to look after their kids.
We're doing the best we can.
Sarah Paquette's daughter attends Hickory Elementary. She works from home. She and other parents are trying to help each other out.
A lot of them are being able to work from home. A lot of them have spouses and they're just trying to figure out the balance of the days.
Inconvenient, but Paquette says not horrible. Children of many low-income families might be going without lunch and breakfast. The district doesn't want that happening. It will be offering free meals to go for parents to take those meals home. Rich Van Wyk, Channel 13, Eyewitness News.
Soon after Avon schools announced their closures, Indiana University and Purdue University moved to online learning. IU leaders said while there were no known cases of COVID-19 on any of their 9 campuses, they were taking these steps to slow the spread of the virus. Faculty and staff were to work from home. Students were encouraged to travel home if possible.
A lot of people are happy, but it's kind of like unnerving the fact that they I feel the need to cancel classes and make them online.
It was shocking, but it was also nice to know that they're being proactive and taking the precautions needed to protect their students.
Days later, on March 12th, a major sports event was canceled. The Big Ten Conference canceled the men's basketball tournament. It was underway in downtown Indianapolis, and that news stunned fans.
No! It was our year!
A range of emotions as Big Ten fans learned the tournament had been canceled. Iowa's Mike Moriarty was inside when the announcement came.
Well, it was already weird because there were no fans. And then suddenly they called Rutgers and Michigan off the floor. And then they started asking us all to leave, and then they made an announcement, and it's very strange.
What was the reaction inside?
Very sad.
Very sad.
A few tears from senior
parents. The only people here are family. They're the only people that were let in, so it's personal.
And disappointing to fans hoping to catch the games on TV.
I'm just sad. I was looking forward to cheering on my Boilermakers.
Somewhat surprised, but yet not after the NBA stuff that happened yesterday. But canceling the games altogether was kind of disheartening.
Fans with tickets got refunds, and the same for many staying at downtown hotels. But not everyone was headed home.
So you're heading back today. There's no reason to stay, I presume, right? Or...
No, I'm going to stay in the city and enjoy the city because we're in an Airbnb and not going to be able to get our money back for that. So we're just going to enjoy Indianapolis.
Changes started to accelerate. The next day, the Indianapolis Public Schools announced they were closing all schools effective immediately.
Marion County officials did not mince words.
This virus and the threat it poses to our city, our state, and our country is massive.
In response, taking drastic steps to try to curb the spread of coronavirus, not only limiting public gatherings, but making the call to shut down schools throughout the county.
This closure, coupled with previously planned spring break periods, will allow all of our school systems to remain closed through April 5th.
Thousands will be out starting Friday. More will join on Monday. So far, 2 people have tested positive for COVID-19 in Marion County. Neither is a school-aged child, but health officials stress this is not some overreaction.
If I'm on the side of caution and I'm worried about children, I will always err on the side of caution than to find out a month from now this is way more worse than we suspected.
My hair is always okay.
While it was a cause for celebration for some students, for parents, it can be complicated.
I feel it's pretty upsetting for people, for parents that have to go to work.
This mom has 2 children in IPS and thinks she'll be able to stay with her kids even while working, but worries about others. The good news she learned is that there are plans to make sure students are still fed.
Usually the IPS schools around here are pretty good with that. They usually send out an email saying we're going to still provide school lunches and all that. So I think that's a good thing for them as well.
District-specific notices will be going out to parents about the use of any e-learning days and how to pick up meals.
As schools and events canceled, the lines at grocery stores got longer and longer. 13 News reporter Mary Mills went to a Costco in Indy to show us how customers were coping.
I planned to pick up a few things at Costco until I saw the traffic backed up, the parking lot full, and all the people stocking up this woman for a month.
That's what I was advised to do. Water, eggs, cheese, staples.
Don't go. It's long. Lines are long. It's long. It's really long in there.
But I did, and this is what I saw. A long line from the front of the store to the back, snaking through the aisles. Most carts overflowing, many people loading up on bottled water and toilet paper. To seem the craziest, some said not worth it and walked out.
Why are people so afraid?
It's craziness.
It's just the fear. People are just scared to death for some reason.
This woman was willing to wait. She was shopping for friends.
Take toilet paper and paper towels to them because I know they can't get out.
So you're helping other people?
Yes.
Despite everything, several shoppers gave employees here high marks for keeping their cool and trying to keep things moving. Mary Mills, Channel 13 Eyewitness News.
The shutdowns impacted so many businesses, and we were no exception. With little notice, we mostly evacuated the WTHR newsroom. We started doing broadcasts from our homes. How that looked and what we learned ahead.
I am officially declaring a national emergency. Two very big words.
Welcome back. A week after the first COVID case hit Indiana, President Trump officially declares the coronavirus outbreak a national emergency. That designation freed up $50 billion to help Americans impacted by the pandemic. The president also asked all hospitals to activate their emergency preparedness plans, and he spoke about access to the COVID-19 tests. At the center of those tests is one just developed by Roche Diagnostics in Indianapolis. The FDA approved it within hours of getting the application by using what's called its Federal Emergency Authority. Now, it's not a vaccine, but it can increase the volume of testing for the virus. It's an automated machine that can process anywhere from 1,100 to 3,300 tests a day.
In this situation, in great partnership with the FDA, the CDC and others, we have actually gone from identifying or sequencing the virus to having a fully automated emergency use authorization kit in the period of 6 weeks.
On March 16th, 10 days after the first case of COVID in Indiana, Governor Eric Holcomb announces the first coronavirus death in Indiana.
It was a point that they wanted to make sure of. They wanted to make sure that in this case, the first victim in the state of Indiana from COVID-19 would not die alone. And they didn't.
Well, we had hoped, prayed, and worked hard so this painful day would never occur. Sadly, we knew it would. Still, sadly, we anticipate that it will again.
This individual fits into the high-risk categories of being over age 60 and having health issues. The problem is that this individual would not have died if it was not for the COVID-19 infection. What makes this really hard is that this individual's significant other was also infected, and so the two of them could not be together when this patient passed. We had to do iPad conferencing so the two individuals could see each other. So that this individual would not die alone, one of our nurses stayed in the room with this patient.
Most people have mild symptoms, and they should stay home, and they should contain their illness in their homes and isolate themselves from other people in their homes so they don't spread it within their families. But unless you become ill enough to go to the hospital, not everyone needs to be tested.
She went on to say about testing that there will be tests for Hoosiers, but she cautioned it could also bring a sense of false security, since you could be negative one day and the very next week be positive. At the State House, Kevin Rader, Channel 13, Eyewitness News.
That very same day, the governor also announced that bars, nightclubs, and restaurants were required to close to all in-person customers and may switch to provide takeout and delivery services through the end of March.
Local franchises like the owner of this McDonald's hope to keep business going through the drive-thru and online. The same for smaller restaurant owners depending on delivery drivers to keep business going. As Jamaican Breeze restaurant chef Jermaine Dennis prepared a takeout order Monday afternoon, he learned, thanks to COVID-19, it's the only way they can do business for the rest of March.
It's not just about being a business, trying to make money, but also make sure everybody is in good health.
Indiana Governor Eric Holcomb ordered the restaurants on takeout only and all local bars to shut down. So it's a double whammy for Jamaican Breeze. Andrea Manning hopes it will mean more business for food delivery drivers like her.
Grubhub has offered the no contact solution if that's what they prefer. We keep hand sanitizer and we're washing hands and all of that as much as we can.
The restrictions will challenge mom and pop restaurants.
That's what makes it so special, you know. It's not something you can get just anywhere, because the spices, we get them directly from Jamaica.
So Jermaine and franchises like McDonald's will depend heavily on customers using their online app to place orders and hope that after COVID-19, they bounce back to business as usual.
We hope, and I think we will.
Before you head to a restaurant like these customers you see in the drive-thru, the restaurants encourage you to order online to make your pickup a lot easier. Steve Jefferson, Channel 13, Eyewitness News.
Another ban soon would go into effect. It would ban gatherings of 50 or more people, and that forced many Hoosier couples to postpone, even cancel their weddings.
At Christmas time, Tyson and Catherine asked people to save the date. They planned to be married April 25th in Shelbyville. But the COVID-19 crowd restrictions forced them on Monday afternoon to postpone their wedding day.
Our honeymoon was supposed to be in Disney World, and obviously they're closed until the end of the month, and we're also supposed to go on a cruise, and so you keep getting emails about how it may not happen or it may happen, so everything happening, we just postponed it.
Tyson and Catherine expected over 100 guests for their wedding here at St. Joseph Catholic Church next month, and they still want to have a church ceremony for family and friends. They just don't know when that will be. Finding a new date is not their biggest concern right now. Catherine is laid off as the assistant manager at Republic Theaters, closed at least for the rest of the month. Tyson owns part of the local radio station, but when advertising dropped, he stopped taking a salary so other employees still get paid.
And there's a lot of people that are really struggling right now. You know, just because we're canceling a wedding in the grand scheme of life that's really kind of minor.
I just have to remember that the day will come and it's not over. It's just a change of date. My magical day will be there.
Is it really about the reception? Is it really about all the extra stuff that comes with it? I mean, it's nice to celebrate, but let's just be honest, it's about teamwork.
And at the end of the day, we have each other. So that's the most important part.
For better or worse, even before they say, I do. I'm Rich Knight, Channel 13 Eyewitness News.
March 18th, a major announcement from Eli Lilly, which is headquartered in Indianapolis. The company announced that their scientists would partner with the Indiana State Department of Health and with the support of the FDA, accelerate testing in the state of Indiana. With Lilly jumping into the fight against the coronavirus, that meant anywhere from 1,000 to 2,000 Hoosiers could be tested for the virus every day.
In addition to testing samples acquired in healthcare facilities across the state, Lilly's also piloting a drive-through testing facility that may be able to enable testing of patients outside of a healthcare facility and thus further avoid spread of the virus.
I've signed another executive order that calls on all Hoosiers to hunker down. Stay at home.
Days later, as positive cases started to rise across the state, the governor issued 2 executive orders, one of which for Hoosiers to stay and work at home.
On March 6th, Indiana had 1 positive case. Today, 259.
So we joined neighboring states of Ohio, Illinois, and Kentucky in telling residents to shelter in place.
I've signed another executive order that calls on all Hoosiers to hunker down. Stay at home. Unless you're going out on an essential errand or essential work or essential business.
So the biggest question now is how can that be enforced? The answer? State police and local law enforcement. And then what constitutes essential work? The list is lengthy. Grocery stores, gas stations, pharmacies, police and fire, hospitals, garbage pickup and public transit, just to name a few.
So stay home. Get groceries only when you need them and only buy what you need. I'm telling you, the next 2 weeks are critical. That's March 24th through April 7th.
So the next question has to be, what constitutes essential activity? Well, health and safety, supplies and service, essential work, and last but certainly not least, to take care of others. Then the governor took on the issue with restaurants and bars that continue to violate his earlier edict, permitting only carry-out service.
Today, I signed an executive order that instructs the ATC to suspend any and all food and beverage licenses for those who violate the order.
The governor did take the time to thank Hoosiers for what they have already done, but clearly his main duty today was to prepare the state for the challenge that lies ahead.
We need to slow the spread, and we need to do it now. Friday, Marion County had 47 positive cases. On Saturday, 82. Today, the number is 110. Overall, sadly, 3 Marion County residents have died.
The goal now is to prevent those numbers from getting any higher. Kevin Rader, Channel 13, Eyewitness News.
It was the kind of spring day not to be missed. The perfect day for the Khans to take their new baby out for a stroll.
We have little Isla.
Yeah, that's our baby.
She is 8 weeks old.
Yep. So we're just trying to help her see some of the outside and get some outdoor time as well, some fresh air.
Their outing came on the first day of the governor's stay-at-home order, which allowed for people to get outside and exercise while maintaining social distance to protect from spreading the coronavirus.
You have an infant, but you also have grandparents, and you have people that are also susceptible to it. So a lot of people say, I can't get it, it won't affect me, but you have somebody in your life that it can affect and it would affect. So just trying to be cautious for everybody.
That's why Antonio Medina was running alone Wednesday afternoon. He usually runs with a group. COVID-19 has changed that for now.
We're avoiding the gathering of people, so therefore, we're kind of running and tagging each other on Facebook, so just to kind of keep going with our miles.
Everywhere you looked, it seemed everyone had the same idea, getting out in the sunshine to do something. On the Monon, bicyclists like Mary Welter took advantage of the weather.
The sun's out, so yeah, I'm out for a nice ride.
So I hooked up with a friend. We stayed 6 feet apart, and we took a 22-mile bike ride and just talked and got reunited. And we thought we'd be the only ones out here, but we found out it's just been flooded. There's been more people than cars.
It was the same story at the canal with families out here together taking walks. Some people just out here by themselves, but everybody working off that cabin fever.
But it feels definitely good to get out and see people, we still have a life and we're going to get through this time.
Dr. Neil Ramchandani is a general surgery resident. He's not treating patients with coronavirus, but said the days have been long for doctors, nurses, and medical staff who are.
I think everyone's kind of feeling it, and we're kind of preparing for the worst, hoping for the best.
And part of that hope came from being outside, interacting with each other, even at a distance.
Max, how you doing, buddy?
You doing okay,
doing
Max?
all right with social distancing?
Oh yeah, he's been doing great. He's a terrible social distancer.
The changes impacted media all across the country and right here too. Tegna, which owns WTHR, supported all work-from-home initiatives. Angela Bachman did the weather from her house. Dave Calabro started looking for good news to share. I set up a studio in my home and showcased the work of local artists for a backdrop. There were moments of real life, pets jumping into shots.
That's why I didn't tell Ziggy he had to get down, because this is just crazy.
By October, a handful of staffers transitioned back to the studio, but the rest of the team would continue to work remotely for more than a year. All the while, the key messaging throughout the shutdown was to stay isolated and keep up communication. A nursing home in Bloomington found a way to do both.
The weather can really bring you down when you're on the inside looking out. Garden Villa Retirement Community, like every other retirement home in America, is on lockdown, so their loved ones have to stand on the outside and look in.
Hello. They understand what's going on, but not necessarily totally grasp it. So all they know is they don't see their loved ones.
Since they're forced to live like fish in an aquarium, the staff wanted to find a way to keep their spirits afloat.
We came up with an idea of using our social media.
So the 135 residents are taking turns with a whiteboard.
We've set up some Skype accounts for them, bought some iPad minis. So we're trying to find any way we can so they can communicate with their families.
And it's working. All these residents who were seemingly locked in have become social media darlings.
We had some funny posts that went out and some really sincere ones, and from there it's kind of expanded. We've got families that come in and see their loved ones through their windows. We've had church groups come in and sing to them.
88-year-old Howard Campbell loved it so much he wrote his own whiteboard message. But when we asked him about the virus, COVID-19, he said,
"This is not my cup of tea."
Yeah, it's not mine either.
Whether we're taking those pictures and sending little messages on the whiteboards, you know, when we take them, we show them to the resident, and they just smile, and that's the highlight.
79-year-old Rebecca Norris chit-chatted with us for a bit.
Is everything okay on the outside?
It's wet out here.
Well, I'm nice and cozy in here.
Then she decided to write a whiteboard message especially for us. It read, "Okay, family, miss you all, but I'm fine. The staff is taking good care of us. P.S. The news guy asked my age. Don't believe it." In Bloomington, Kevin Rader, Channel 13, Eyewitness News.
On March 26, a major postponement in the sports world. The Indy 500 gets pushed back. The race moved from the last Sunday in May all the way to August 23rd that year, all because of the coronavirus. It was one of the many major sporting events impacted by the pandemic. All of the concerts scheduled for that May were canceled, and the Grand Prix moved to the 4th of July that year as well. Many Hoosiers played a part in the fight against COVID-19, and that includes one family-owned company in the small town of Washington, Indiana. This family worked overtime, quite literally, to keep healthcare workers protected.
Workers at Fleece Performance Engineering in Pittsburgh are packaging and shipping out protective face masks.
We've gotten orders from the state, and we're branching out even further than that into we've shipped to Washington, California, everywhere in between.
16,000 plastic shields so far for healthcare workers and first responders. It's a brand new industry for Fleece. 4 days ago, they were making car and truck parts, but the pandemic caused engineers to grab supplies and get creative.
Within 48 hours, we had designed, tested, made a couple iterations, sent samples out to Hendricks Regional Health to test, and then subsequently filed for a patent and applied for a patent, and then shipped 600 units within 48 hours.
They soon hope to manufacture 10,000 masks an hour. Local hospitals already responding with gratitude for filling a critical need. For this family-owned company, it's personal.
My wife's a nurse, my sister's a nurse, sister-in-law's a nurse, so it's like, how can we make a difference?
It's not the only business making a difference. Primex Plastics in Richmond is manufacturing its own face shield. Reed Hospital expressed a need, so Primex says its design team worked Apollo 13 style last week, laying out parts and creating a prototype. Two companies getting inventive.
Present us with a challenge, and we'll take it on for sure.
To protect those on the front lines of COVID-19.
By the end of March, Indiana went from one positive case of COVID-19 to over 2,000. Scott Swan looks at some of the major statistics from that final day of March 2020.
Let's break down the numbers so you have a better idea of the coronavirus pandemic across Indiana. We had 373 new cases since yesterday, bringing our total up to 2,159. 14 more Hoosiers have now died from COVID-19, bringing our death toll up to 49 across the state. But tonight I want to give you some more context so you have the facts, not fear. This is the largest single-day rise in deaths we've seen since Indiana recorded its first death back on March 16th. Now, state leaders are telling us the surge is starting, but the peak is still weeks away, sometime between mid and late April. So Indiana right now is preparing for an increase in positive cases and deaths. Right now, hospitals are working to get more beds, ventilators, and healthcare workers to make sure they're equipped to handle the surge. Let's break down the state numbers for you and show you the map of Indiana. The counties that are in the darker red have the highest cases. So while you do say Lake and St. Joseph County with high numbers, let's concentrate on what's happening here in central Indiana. In Marion County, 964 confirmed cases of COVID-19 and 17 deaths. In Hamilton County, 127 cases, and down here in Johnson County, 101 cases. It's important to note, though, that Hamilton and Johnson County have two of the larger populations across the state. We're also seeing an increase in testing across the state. We've had more than 13,000 Hoosiers tested so far. Only a couple thousand, though, have tested positive in Indiana.
Now, 5 years later, the effects of the pandemic remain with us now. It impacted how we work, how our children learn. Some businesses never recovered. Some are forever changed. It made us grateful for our healthcare workers, and it made us question our national healthcare leaders. Now, as we move forward, may we remember those that we lost and always make our health a priority. Thanks for watching. I'm Anne Marie Tiernan.